A few days ago, I said, and I quote, "Social distancing and sheltering in place, though necessary and life-saving for many, created intolerable hardship for others." I ran into Rich Besser, CEO of the Robert Wood Johnson Foundation, and here's what we discussed about those words. While I have advocated publicly that we all stay at home to slow the spread of the coronavirus, and I've issued urgent calls for more protective medical equipment for our nurses and doctors around the country, we know that this crisis, the crisis we're facing today, is not just medical. No, it's much more. There are painful cultural and economic human costs associated with these essential public health policy measures. The vulnerable populations in this pandemic are not only the medically at risk, but children who depend on school breakfast, hourly workers who have no sick days or childcare, rural and native populations who are far removed from healthcare facilities, people experiencing homelessness or who are incarcerated and have no freedom to practice social distancing, the elderly and disabled whose support systems are compromised. Every one of us is feeling the stress of these uncertain times, but the greatest strains fall on particular demographics because of a specific economic or social or health status. If we don't empower everyone, that's everyone, including the most vulnerable among us, with the ability to follow the government's and the CDC's sweeping recommendations, the recommendations are effectively just words impossible to implement. Our elected representatives in Washington and in our state houses must enact policies that everyone has the opportunity to protect their health and the health of their communities. And we as private citizens in our own individual ways can help out as well. At the federal level, there are fundamental universal supports that can reduce the short and long-term impacts of the pandemic. Let's let our elected officials know we expect them to act on these issues now, today. Among those supports are eviction and foreclosure protection, boosting unemployment insurance, full health insurance coverage during the pandemic to help keep people from getting sick, either from COVID-19 or anything else to keep them out of the healthcare system, more complete funding for Medicaid, and food security to maximize everyone's ability to fight disease and remain healthy. While practicing social distancing ourselves at home, we can still invest in our community economies by ordering takeout from local restaurants, by buying gift cards at our favorite stores and restaurants for use at some time in the future, donating to local food banks and supporting neighborhood meal programs. Follow the businesses you usually frequent on social media to see if they're offering some sort of special services or packages. If you can, keep paying for memberships and subscriptions, even if the services have been suspended. By doing so, you are making important investments in these businesses' futures and allowing them to keep their staff employed. And most importantly, reach out to each other. Check in, keep texting and chatting, but also pick up the phone and call your friends so that they can hear your voice. Be especially considerate of those who live alone. Send them pictures and write them cards. Let them know you are thinking of them. Our current situation is not only a public health emergency, it's an economic and cultural stressor as well. In times like these, each one of us is given the opportunity to significantly improve the lives of others around us. And we will together continue to rise to this unprecedented challenge. Keep your questions coming to this platform, and I'll do my best to share the latest, most trusted information to video like this and to my podcast, A Second Opinion with Bill Frist. Visit asecondopinionpodcast.com. That's asecondopinionpodcast.com.